Hi, I'm Dr. Christina Anderson, or Dr. Chris as my patients call me. I am a Los Angeles chiropractor who specializes in pediatrics and pregnancy. I've been in practice for over 30 years, and this is my passion, talking about how to keep kids healthy and have them grow up healthy. And this is why I'm doing this series on primitive reflexes, because the primitive reflexes create the basis of the brain development that occurs very early on in life. It starts in utero and continues throughout the first year of life. And with this particular sucking reflex, if there's an issue with the sucking reflex, we're going to talk about the problems that can create. And if it is retained and not integrated, then there can be problems with speech and feeding and texture, a tendency to suck and chew on things. So we're going to go further into those indicators in this video. So I just want to backtrack a little bit and remind you, if you have not yet watched my video on the neurologic reflexes, to go back and watch that. That gives you an overview not only of primitive reflexes, but our other reflexive systems. I'll put the link in the description. And also there's an overview on primitive reflexes. I highly recommend going back and watching this video. I've also created a playlist of the primitive reflexes as I've been doing these videos, so you can watch them all the way through if that's something that you would like to do. So let's start talking about the sucking reflex. Now, it begins development early on in utero, but it really becomes fully developed about 32 to 36 weeks in utero. And this is why sometimes if you are getting an ultrasound done, you might see your baby sucking their thumb. And it is one of the main primitive reflexes that we need to survive. So this is something, if a baby is not having the reflex of sucking, if it's not there, then they are not going to be impelled to feed. So that can be a problem. So really, really necessary for survival. So basically, when you put your finger in a baby's mouth, or if they're feeding a nipple of a mom's breast or bottle, the baby's going to place their lips around your finger and rhythmically squeeze it between their palate, which is the roof of the mouth, and the tongue. And that's going to create a negative pressure, which is a suction. It's going to be really hard to pull your finger out. That is what should occur. Now, if the baby is actually feeding, there's an expression phase where the tongue is involved of pushing back, and it's sort of like it's like this motion here where there's the tongue pulling forward and back, and that's helping the milk to be expressed, which obviously you're not going to experience with your finger, but that's what needs to occur for milk to come into the baby's mouth, especially with nursing and breastfeeding. So we know the nutritive function, right? So with sucking, the baby's going to be taking in breast milk either via the breast, or if there's bottle feeding with breast milk or formula, some sort of nutritive value. We need to get food into this baby. So that is an obvious function of the sucking, but there's other reasons why babies might need to suck. And some babies need to suck more than others. So it's a very calming action to be sucking, so it does soothe them. It actually lowers their heart rate and blood pressure and reduces their stress hormones. So this is why sometimes babies will need to suck just for comfort. There is an actual physiologic reason. With actual breastfeeding, so this doesn't really occur with bottle feeding or any other supplemental feeding, but with breastfeeding, it takes a lot of work. And it will actually affect the development of the craniofacial structure. So the bones of the skull and the bones of the face which are molded by the muscles that are needed to breastfeed. There's also going to be an element of how much strength is needed for the tongue and the cheeks to work to express that milk from the breast. And this is another reason why breastfeeding is so important, but not just breast milk, which some moms, if they're having trouble with the feeding, will pump and give to the baby in the bottle, but the actual at the breast nursing plays an important part of the development of the face, the mandible, and the top of the jaw. So you're going to affect the teeth and the development of what the face will actually look like. So we're going to talk a little bit more about that. So what happens in a newborn if you are checking and there's no sucking reflex? You put your finger in their baby's mouth and they're not into it, they're not sucking, and they're not drawing the finger back in, or maybe they're even pushing the finger out. Well, if the baby's premature, it might be because the reflex has not developed yet. So that can be an issue with premature babies. And in this case, if you do want to try and help establish breastfeeding, there's devices that you can use that lactation consultants can help you with, or someone like myself can help you with, that will allow for milk to come down into the baby's mouth while they're doing the action of trying to latch onto your breast. Also, with newborn babies, especially if they're premature, they might have difficulty coordinating the suck, swallow, breathe. So it takes a lot of coordination to be able to, at the same time, when you are taking food into your mouth, or in baby's case, the milk, they have to suck and then they have to swallow, which closes off the airway. So they have to figure out how to breathe while they are nursing. And so we don't think about this, but this is something that goes into especially nursing, but even if they're bottle feeding. So why might there be other reasons that the sucking reflex is absent or weak? Well, maybe there was something that went on during the birth. Maybe there was some birth trauma. Maybe there was prolonged time in the birth canal, or some interventions were used like forceps or a vacuum, or there was a C-section done because of, for whatever reason, positioning of baby, or baby's heart rate was going down, some sort of issue going on that they needed to have the baby come out. So any type of birth trauma could cause problems to the areas in not only the cranial bones, which I'm going to show you in a second, but let me grab my little friend here. So with the birth process, you want the baby's head tucked in. Hopefully the back of the head is presenting. This is called the occiput. And you want everything lined up. Now, if the head is turned or if it's extended, it's going to put a lot of pressure right back here at the back of the head, and also at the upper part of the neck. So there can be some cranial bone and dural restriction. The dura is the covering around the brain and spinal cord. And that can create some brainstem interference. And this is where the location is of the primitive reflexes, all of them, as well as the cranial nerves. And you might also see that the rooting reflex might be absent. Now I'm going to put the link to that in the description, but basically that's how a baby gets ready to suck. You would stroke their cheek, they turn their head towards the stroking and open their mouth, already nice big mouth open so that they can take the nipple in to nurse. So I'm going to just go forward a second so you can see this area. This is what I'm talking about with the brainstem location. It's really important to know this physiology because then it explains so many things about why babies might have issues with things like nursing and breastfeeding. So that bottom picture you see there in the purple, there's a red area there. That is the brainstem. It's just a depiction of the brainstem. And you can see the yellow arrows there are pointing to the boundaries of the foramen magnum, which means big hole, in the occiput, which is the back of the head. So right up at the top there on the right, you see that green shaded area that's outlining. This is an adult skull, but it gives you a better idea that where the occiput is at the back of the head, and right below that green shaded area you see the first cervical vertebra there and its proximity as well to the brainstem. And then to the left you can see that would be as if we were looking down from the top of the head. There's no brain there, we just have the occiput, and that big hole there, that's where the brainstem is located. So this kind of makes sense that if we are having trauma, or even actually birth itself, even if everything's lined up, it can create problems here because there's a lot of pressure and a lot of things going on with the cranial bones during birth. But if this area is affected, one of the first things that you might see is that the baby is not having a suck reflex because the brainstem has compression from the dura, the covering around the brain being compressed, and or the occiput, the back of the head, compressing into that area, along with maybe the upper cervical bones, the bones in the neck. So that's that subluxation of the neck, cervical. There might also be issues with the jaw. So the jaw is a separate bone, just really connected by muscles, and that can get out of alignment during birth as well. And if it is out of alignment, then the baby might not be able to suck efficiently and suck very well. So this is where chiropractic and craniosacral work can be so helpful to remove that interference from the nervous system, from the brainstem, from the spine and the nerves going out to where they need to go to do the sucking, so that the baby can then self-regulate, self-heal, and do what they need to do to feed. Now I have at the bottom there lip and tongue ties. This is something I also check because if there are ties underneath the tongue and also at the lip, sometimes there's ties in the cheek. These are less common, but it's going to affect the way the baby will be able to suck. They may not be able to get their tongue around the nipple to suck efficiently, and therefore that would create a weak or even an absent suck. So these are important things to look at. Last week I did an interview with Dr. Sandra Caleros, and I will put the link in the description so you can go back and listen all about lip and tongue ties. And I'm also going to put a link to the craniosacral. You'll see this one, the craniosacral therapy for babies. It's applicable to everybody, but I really wanted to show that this is something that is so great for babies. And you can even see in the picture there, I've got my finger in the baby's mouth and then another hand at the back of their head. And one of the things I'm doing is evaluating suck. And I can also deliver some nice gentle therapy through the mouth if I need to. I'm going to go back to this diagram here because this is just showing you a little depiction of the cranial nerves. There they are coming off of the brainstem, and there are so many that are related to the sucking reflex, like the trigeminal nerve and the facial nerve and the glossopharyngeal nerve and the vagus nerve, because they're involved in a little bit also the hypoglossal nerve. The accessory nerve is needed to get in the right position for nursing and is involved in the rooting reflex, as I talk about in that video. But there are so many of the nerves that are needed for proper breastfeeding and nursing and the suck reflex. So if this area is compromised in a newborn, this is why you might have an issue with sucking and especially nursing. Okay. So what might the red flags be that the sucking reflex is a problem? There's a weakness or an absence. And this isn't just exclusive to the sucking reflex. It can be other problems such as issues with craniosacral or neck problems, but usually it all goes together. So mom might come in and be complaining that breastfeeding is so painful. Her nipples are sore, they might be cracked, they might be bleeding. It's just agony to nurse because the baby isn't able to suck efficiently and properly. So oftentimes they're just on the end of the nipple. They don't have the full areola in their mouth, and it's not the optimal way for nursing. And also, if the sucking reflex is not present, they may not be efficiently nursing. So mom's breasts are getting filled up, but the milk isn't coming out. So there's that reflex there. On demand, we're making milk. And if that baby is not able to get all that milk out, it's going to get backed up. The other thing that can happen is the baby can get sleepy when nursing. So if they're not being efficient with the milk expression part, they're going to get tired. It takes a lot of work to breastfeed. And so they're going to fall asleep while they're nursing. Or they might still be hungry after nursing for the same reason. They're just not getting enough milk. Not because mom isn't making the milk, they're just not able to express it. Other times they're having trouble with that suck, swallow, breathe. And they might be coughing or choking while they're nursing, and moms will come and say, I'm producing too much milk because this is what happens when they get on. Well, it's not that they're making too much, it's just the baby's not able to coordinate those three things. The baby might arch or stiffen their body when they're nursing because they can't comfortably get into the position to nurse due to possible subluxations in the cranial system, the neck, that type of thing. Or they might make gulping or clicking sounds when they're nursing because their lips might not make a good seal, their tongue might not make a good seal. They might have a lip or tongue tie. Sometimes this occurs with that. And so you will hear sounds, and sometimes they'll use more of their jaw to hold onto the nipple rather than the suction because they can't get the tongue around. So you might hear some sounds there, and that's where usually moms will also have some discomfort because of that clamping of the jaw. If they gulp, they might take in too much air, and therefore they might be gassy afterwards or spit up. And they might also not gain weight for the very reason that they're not expressing enough milk, even though they are on the breast, and sometimes for a very long time. So what might you see in a child who has a retained sucking reflex? In other words, this primitive reflex should integrate or effectively disappear. The babies won't have the reflex when you stick your finger in their mouth to automatically suck, but they can choose to suck. In other words, it's a volitional response. The brain has control. If they want to suck after 3 or 4 months, they can still do it, but they're in control of it. So if the sucking reflex is staying retained, you might have speech issues. This is because speech requires the motor function of using the lips, the tongue, the muscles of the face. So remember those cranial nerves? That's all of that. They might have trouble articulating words or pronouncing certain words. They might mumble or they might have a lisp. All of these things can be indicators of a retained sucking reflex. They can certainly have eating issues because that tongue is necessary to move the food backwards and move it around the mouth in order to chew and swallow. So again, they might have issues with chewing and swallowing. They might prefer maybe pureed foods and take a long time to decide that they want to actually chew foods. There might be texture sensitivities. A lot of times they're picky eaters. There's only certain things that they're going to eat, and they have a very limited repertoire, and that's it. Or they might be really messy because they can't control what's going on in the food in their mouth, so it ends up everywhere. Might dribble out of their mouth. So that's just the control of the muscles of the jaw, the tongue, the lips, the mouth. There's problems with that, and that can lead to some of these eating issues. They also might have a tendency to constantly put things in their mouth, whether it's their shirt collar or a pencil that they're chewing on, or their thumb if they're a thumb sucker. They've always got to have something in their mouth, and that's another indication. There's a reflex associated with the sucking reflex and the hands. It's actually called the Babkin response. And so when they are writing, if they stick their tongue out when they're writing or concentrating, that's the sort of response. And again, it might indicate a retained sucking reflex. And because, remember, I talked about breastfeeding and the beneficial effects on the facial development. Well, if a child does not breastfeed, that can affect the development of their face and their cranium and their teeth. It can also affect their teeth if they are a constant thumb sucker. So you can get an overbite, you can get buck teeth with them sticking out in the front, or there might be a high palate or something like that. So these are some indicators. So what can we do? Well, first of all, you can do things that are using these facial muscles. So facial exercises where you're having them use their cheeks and their tongue, like anything with blowing bubbles, whistles, trying to blow balloons up, blowing into a harmonica. You can use a straw and blow through it to blow things across a table. You can have them you can color some water and have them make designs with blowing through a straw. So this is using a lot of the facial muscles and also the action of sucking. So have you ever tried sucking like a really thick shake through a straw? It is like, it takes a lot of work. So you can try having them use different size straws with different foods and drinks with different consistencies, and that will use their facial muscles a lot. Then there's jaw exercises. So using the movement of the jaw, and you can play a game with them. This is stuff you can do really even early on when babies are in the imitation phase, but certainly even with a toddler, and of course with older children. So just doing things like opening the mouth wide and then dropping your jaw down as far as possible. Try not to move the head, moving the jaw side to side, moving the jaw forward and back. And, really crazy faces. So you can have a lot of fun with this, almost like a Simon Says type of thing. And you can also have them make the sounds of wee and why and whoa and wah. So you get the idea where you're really wanting to use the jaw quite a bit. Then there's lip exercises. And with these, you're trying to use the lips as much as possible. So you can push them forward. You can retract them. You can tuck them in like you're blotting your lips. Alternating pouting and smile. Pucker and then move the mouth from side to side. And fish lips, which is one of my favorites. That one's a little bit of a hard one. And then, of course, you want to also do tongue exercises. Now, with this one, you can get a little creative and a little fun. You can put a little bit of food at the corners of the mouth and have them lick it off. So maybe they have a favorite food or a food they only get to have sometimes, maybe some coconut ice cream or something like that. So you can have fun with that. You can put a little bit here and have them lick it off, and down here. So you want to get them to move their tongue as much as possible. And you can also put food all around, and so you can have them lick it off with their tongue and then go the other way. So it does get a little bit crazy, but you know, whatever you can do to help with this. And you can also play a game where, you know, you can have them stick their tongue on either side of their cheek. You can put your hand there and have them push against your hand with their tongue. You can also have them run their tongue underneath the lips like this. So a little bit harder, but you know, you can get creative with it so that they're using their mouth, their jaw, their tongue, the face as much as possible. And then you can ask them if they can do the tongue straw. It's a recessive trait, so they might not be able to, but they will certainly use their tongue trying to do this. So some other things that you can do are use oral motor exercisers. I just have a few up here. These are readily available. Yeah, if you just look them up. There's the ARC Therapeutic, there's the Nuke, and then there's the Abalex. And a lot of these will have booklets that go with it or videos that go with it, and often have a vibratory component. So you can use them to do some of these exercises that I was just talking about. And it can be a good way to start using the muscles of the mouth. So this is where you can find me at losangeles-chiropractor.com. Again, I'm board certified in chiropractic pediatrics and pregnancy, and I have my certification in childhood developmental disorders, which is based on functional neurology. So in other words, there's nothing pathologically wrong with the brain. It's just that things are not, information isn't connecting. So this is where I come in to help figure out where are things not connecting and how we can get them connected. So I can do that remotely for some things, and other things, especially for the adjusting and the craniosacral work. Yes, I do that in my office as well. And besides having 30 years plus of clinical experience, I am the mother of 3 children, so I have practical experience as well. All right, everybody, I will see you next time. Please share this with anyone who you think might benefit. Certainly, if anybody is pregnant and going to have a child, this is really pertinent and important information for them to have, or if you know of anybody who's having breastfeeding issues, or their child is having challenges that we mentioned in the video presentation, please share it. This can really help so many people, but I need your help and support to be able to do that. And give me a thumbs up if you found this helpful, because it does make a difference in how many people will see this video. Thank you so much, and I will see you next time.